People have died, most of them in Wuhan. The U.S. and the U.K. are sending passenger planes to Wuhan to repatriate their citizens. There are 250 Canadians registered in the region. Foreign Affairs says 126 have contacted the consulate asking for help to get home. But at this point, Canada is not sending a plane to get them.
We're trying to contact everyone, assess their specific need for assisted repatriation. We're at the same time consulting with our allies and looking at the different options that people are considering.
The U.S. and the U.K. have now upgraded their travel warnings, advising citizens to avoid non-essential travel to all of mainland China. And several airlines are cutting back on flights to China. At this point, Canada has not expanded its travel warning and is still advising people to avoid the Wuhan region and Hubei province. Redmond Shannon has our top story tonight.
As if further evidence were needed that these are extraordinary times. Hong Kong leader Carrie Lam wearing a face mask, an item she banned last year during the pro-democracy protests. Lam announcing that visitor permits and most travel from the mainland will be limited after Thursday night. Hong Kongers like this man think it's too little, too late. 8 cases have already been reported in Hong Kong. In Beijing, the head of the World Health Organization met with Chinese President Xi Jinping. They agreed for a WHO team to join the 6,000 Chinese medical staff who've been sent to the affected region. The organization says the emergency remains confined to China, but the global risk is high.
So far, it's going back with travelers to foreign countries, whether it's the home country of somebody or a traveler as such. It's not wildly spreading outside of China. But again, we have to be prepared for in case it would.
In Wuhan, state TV shows the much-hyped building of a special new hospital, some prefabricated rooms already in place. Most people living in the city remain holed up at home, many shouting encouragement to each other from apartment windows.
We are not really sure if they are reporting the truth or if they are underreporting the actual numbers or I think it's just not knowing what's actually going on and how long it's gonna last. That's the most scary part.
And cities near the affected Hubei province are increasing checks to anyone arriving. Those with high temperatures sent to hospital immediately. And more than 1,000 kilometers away in Beijing, some empty shelves and long lineups as the first death from the virus is confirmed in the capital. Redmond Shannon, Global News, London.
Now to what we know about the cases here in Canada. Here's Heather Yurix-West.
Health officials say Canada's third presumed case of novel coronavirus did everything right.
This is a gentleman who was well aware of what was going on in China, and when he returned, he went home and he voluntarily self-isolated.
The man had recently traveled to Wuhan, China, but did not have any symptoms until more than 24 hours after he returned.
This person was not symptomatic on his flight. There's no risk to people who are in contact with somebody with no symptoms.
But there are questions within the global medical community around whether or not that statement is true.
Normally with a coronavirus, we see more viral shedding and more transmission when a person is more symptomatic. China has reported there may be evidence of asymptomatic transmission. All of these questions must and will be answered in order to provide a proper risk assessment.
The Chinese embassy in Canada is advising all Chinese nationals returning from Wuhan to isolate themselves for 14 days at home. So far, all cases across North America have been traced back to China.
The coming days and weeks are likely to bring more confirmed cases here and around the world, including the possibility of some person-to-person spread.
Studies on the new coronavirus show that on average, one sick person can infect between 1.5 and 3.5 other people. That makes it a bit more infectious than most seasonal flu strains, in which sick people can infect between 1 and 1.5 others, but less infectious than SARS, which spreads from 1 to 2 to 5 others. It's why public health officials are doing all they can to prevent an outbreak, isolating and testing anyone who traveled to Hubei province and has now become ill.
We need to be